Welcome back to the Wound Talk series from Molnica. In the last episode, we set out on our journey to get our patient, Mary, back to being her normal, happy self by learning about 10 essentials of wound healing and why they are important. We began by exploring our first essential of wound healing, the need to perform and record wound assessment and diagnosis. It's now time to address our second essential of wound healing, the need to consider wound vascularisation and oxygenation. As blood circulates red blood cells, white blood cells, and platelets around the body, hemoglobin within the red blood cells transports oxygen to where it is needed. In the context of wound healing, oxygen is vital as both tissues and cells require oxygen to manage many of the healing processes. It is required to initiate the immune response, drive granulation and build new tissue, repair and heal damaged tissue, and help increase the resistance to bacteria to combat wound infection. If the blood supply to wound tissue is compromised and the wound does not receive enough oxygen and vital blood cells, it can lead to stagnation of the healing process, with complications such as persistent wound inflammation, wound infection, and in the worst case can lead to tissue necrosis and even amputation. Therefore, it is important to consider wound vascularisation and oxygenation for the following 4 reasons. They are required to initiate the immune response, help to increase the resistance to microbes to combat wound infection, drive granulation that builds new tissue, and to provide a better condition for sharp debridement, all of which will reduce the risk of it becoming a hard-to-heal wound. With our second essential of wound healing adhered to, we are one step closer to a healed wound and a happier and healthier Mary. Now that we have explored why it is important to consider wound vascularisation and oxygenation, let's take a look at how we implement this knowledge into practice before we move on to our next essential, preventing and treating wound pain and the issue around loss of sensation.